Hi, my name is Dr. Sina Rangewear from Lifetime Smiles. I get a lot of questions about cosmetic dentistry, so I'm going to answer some of them today. So the basic things with cosmetic dentistry could be just simply whitening your teeth. Sometimes patients have duller teeth, more yellow, and just whitening your teeth can help address some of the cosmetic concerns. Now, other times patients have crowding, they can have chipping, they can have cracks in their teeth, and that's going to require a little bit more treatment. Some of the things we can do could be just bonding. We could also do veneers. We could do a combination of veneers and crowns. So there's many things we can do. Now, bonding, what that is typically, most patients know it as bonding, but it's basically composite filling material that we use to put on the fronts of the teeth and kind of reshape the teeth to get them to look better. And there's different methods of doing that. Cosmetic veneers are actually porcelain veneers that go on the surface of the teeth. Now, those can actually change the shape of your teeth, the color of your teeth, the length of the teeth, the width of the teeth. So there's many things that we can change with veneers. They kind of look like a fake nail that women put on their nails. So it kind of goes over the teeth. Now, with that said, if you have full teeth, it is going to require us to prepare the tooth surface a bit, typically about 0.5 millimeter to 1 millimeter of thickness that we have to reduce in order to put the veneer on the nail, on the teeth. Otherwise, you will have very full teeth. If you have smaller teeth or thinner teeth and we put more thickness, about 0.5 millimeter or 1 millimeter of thickness, then it'll look perfect. So veneers can kind of vary in shape, size, color, and we can do all that to change the shape of the teeth. We can also do crowns to reshape teeth, and it's really dependent on the tooth that we're working on. If you have a lot of fillings or old crowns on the teeth, then we have to remove those and reshape the teeth and then put new crowns on them. At the end, whether it's crowns or veneers, the goal is to make them functional and beautiful. So those are some of the things that we can do in terms of cosmetics. Well, the way you would know if cosmetic dentistry is right for you or your family is really, what is it that you're trying to achieve, right? Are you trying to achieve a more aesthetic outcome? If you smile, do you want to have beautiful smile, confidence in how you smile, things like that. If it's just, you have nice teeth, but they're a little bit more yellow, just whiten them. That's going to possibly achieve what you're looking for. If you are, ashamed of smiling, or you smile with your hand in front of your face, then why don't you give us a call, come in, and we'll take a look and go over the different options with you. The difference between cosmetic dentistry and restorative dentistry really is cosmetic dentistry sometimes is simply to just make the teeth look prettier. So it could be whitening, it could be veneers or crowns. Restorative dentistry is really restoring the teeth back to the form and the function. So it could be that you had lots of fillings and crowns and just kind of patchwork here and there. And now we have to do restorative dentistry. But when we do restorative dentistry, we also can do cosmetics with it. So it's combining both the cosmetic and the restorative aspect and making things not just look good, but also function. I get this a lot, especially in today's day and age, that more and more younger patients, sometimes even kids, want cosmetic dentistry. So that is a question I get a lot from my young patients. The way I typically address it is if they have their full dentition, typically by age 14, 15, I would recommend either doing some Invisalign treatment to straighten their teeth and some gentle whitening to whiten their teeth. If they have what we call peg lateral teeth, so typically that is a consideration for younger patients where not the two front teeth, but the two teeth next to them are smaller. Those are called peg laterals. Because they're so small, they look different and patients don't like it. So typically what we can do is either some bonding or some composite veneers or porcelain veneers just on those two teeth to make them look more symmetrical. The other thing we can do is just some bonding or reshaping the teeth by enamelplasty. Basically what that means is just reshaping the teeth to make them look a little bit more pretty or less squared, which we get a lot of. But as a young child, I don't recommend doing veneers and crowns because their teeth have a lifetime ahead of them, and doing treatment that is more aggressive will cause more problems later down the road. Cosmetic dentistry can actually change the structure of your mouth. Basically, what that means is if we were to do cosmetic dentistry in a simple way, if you have, when you smile and you show just the 6 front teeth and nothing in the back and it looks dark, cosmetic dentistry can actually enhance that by just filling in that space. So basically, we would put veneers or crowns on the back teeth and the front and just make your smile wider. So when you smile, you show more than just the 6 front teeth. So when choosing a dentist for cosmetic dentistry, you want to make sure that your dentist has had experience doing cosmetic dentistry. You want to make sure that they've taken continuing education courses, that they've done a lot of cases and can show you before and after pictures of cases that they've done, that they do a mock-up, some form of a mock-up to show you what cosmetic dentistry can do for you, whether it's a picture or a wax-up or like a try-in of teeth, so that you can kind of see what it could do for you if you were to go to doing cosmetic dentistry. I get the question a lot about, is cosmetic dentistry painful? Well, dentistry in general should not be painful. If you're working with a dentist that is trained and can give you anesthetic and give you the comforts of dentistry, as comfortable as we can make it, it should not be painful. Typically, we do give you topical anesthetics to numb the tissue, and then we give you local anesthetic to make sure that the teeth are numb so you don't feel anything that we're doing. It should not be uncomfortable or painful. The anesthetics that we use for cosmetic dentistry are your typical local anesthetics. So it could be, most people know it as Novocaine, but there are different forms of it. Really, it depends on your blood pressure, medications, things that you're on. That's going to determine what type of anesthetic we give you. Also, the duration of the treatment. If it's for a longer procedure, then we're going to give you something that's going to be lasting a little bit longer than something that is a 30-minute appointment. So we usually use local anesthetics along with a topical gel or spray to help numb the area before we give you the local anesthetic. So a lot of times patients ask, how long is it going to take for them to recover from a dental procedure, or most likely a cosmetic procedure since it's a longer appointment. Typically, we ask that you don't chew anything or eat anything until the numbing wears off. Usually that's going to be a couple of hours. Most of the time, patients are going to be fine. You will be a little bit sore and achy in the area we worked on, but typically we don't need to give you any type of narcotics, or you don't need to take any time off from your work or your daily life. So usually there's very little downtime for any type of cosmetic procedures like bondings, veneers, crowns, things like that. I get the question a lot of, is cosmetic dentistry covered by insurance? Well, no. Anything that is cosmetic is never considered a procedure that is covered by dental insurance. Most of the time, they are not covered. That is something that is, if it is covered, is very policy specific, and we wouldn't know that until we get some details from the insurance that you have. But most of the time, it is not a covered procedure. We do have a lot of financial options for cosmetic dentistry. We have different financing companies that we work with, like Lending Club, Cherry, also Care Credit. Patients a lot of times use their own zero interest credit cards, but through our office, we do have different companies that we work with to help our patients get the treatment that they need. If you'd like to discuss any cosmetic dentistry procedure with me, you can reach us at our office. The phone number is 571-248-0700, or you can email us at mylifetimesmiles@gmail.com, or you can visit our website at mylifetimesmiles.com.